Your mouth is the gateway to your overall health. Oral health affects more than just your teeth. Poor dental care can lead to infections, gum disease, and other health problems that extend far beyond your mouth. Brush your teeth twice daily with fluoride toothpaste. Use a soft bristled toothbrush for 2 minutes each time, cleaning all tooth surfaces with gentle circular motions. Fluoride strengthens tooth enamel and prevents cavities by creating a protective barrier against bacteria. This daily routine removes plaque buildup that causes tooth decay and gum disease. Floss at least once daily. Clean between teeth where toothbrushes can't reach, removing food particles and plaque from 40% of tooth surfaces. Create a C shape around each tooth and slide gently up and down to prevent gum disease and bad breath. Regular flossing prevents cavities in hard to reach areas and reduces gum inflammation. Use fresh floss sections for each tooth to avoid spreading bacteria. Replace your toothbrush every 3 to 4 months. Worn bristles become less effective at removing plaque and may harbor bacteria that reinfect your mouth. Frayed bristles can't reach into spaces between teeth and along the gum line where plaque accumulates. Replace immediately after illness to avoid reinfection. Fresh bristles ensure your daily brushing routine remains maximally effective. Use fluoride toothpaste without rinsing immediately after brushing. Spit out excess toothpaste, but avoid rinsing with water for 30 minutes to allow fluoride absorption into tooth enamel. This concentrated fluoride exposure provides ongoing protection against acid attacks from mouth bacteria. The technique is especially important for cavity-prone individuals and significantly reduces decay rates. Small amounts of remaining fluoride are safe to swallow. Consider using fluoride mouthwash at different times from brushing. Use fluoride mouthwash separately from brushing to avoid washing away concentrated fluoride from toothpaste. Choose alcohol-free formulas to prevent dry mouth, which reduces natural bacterial defenses. This provides additional cavity protection through extended fluoride exposure throughout the day. Wait 30 minutes after use before eating or drinking for maximum effectiveness. Clean your tongue daily. Remove bacteria, food particles, and dead cells from tongue grooves that cause bad breath and spread to teeth and gums. Use a tongue scraper or spoon to gently scrape from back to front, improving breath freshness and oral health. This 30-second routine enhances taste sensation and reduces bacterial load in your mouth. Regular tongue cleaning complements brushing and flossing for comprehensive oral care. Eat a well-balanced diet rich in calcium and crunchy vegetables. Consume calcium-rich foods like dairy products and leafy greens to strengthen teeth and jawbones. Crunchy fruits and vegetables naturally clean teeth while stimulating saliva production, which neutralizes acids and repairs early decay. Foods high in vitamin C support healthy gums and tissue repair. Limit sticky, sugary foods that feed harmful bacteria and cling to tooth surfaces. Limit sugar intake from snacks and beverages. Sugar feeds mouth bacteria that produce acids, creating a 20-minute acid attack on tooth enamel after each exposure. Sticky, sugary foods are particularly harmful because they remain in contact with teeth longer. Consume sugary items with meals rather than as snacks to benefit from increased saliva production. Rinse with water after sugar consumption and brush 30 minutes later. Make water your primary beverage choice. Fluoridated water provides constant low-level fluoride exposure while helping rinse away bacteria and food particles. Water maintains adequate saliva production, your mouth's primary defense against decay and gum disease. Unlike other beverages, water contains no sugars or acids that damage teeth. Use straws for acidic drinks and rinse with water afterward to minimize tooth contact. Avoid all tobacco products. Tobacco use doubles gum disease risk and dramatically increases oral cancer risk through reduced blood flow to gums. Smoking impairs infection-fighting ability and slows healing from dental treatments and procedures. Tobacco causes persistent bad breath, tooth staining, and loss of taste and smell. Quitting tobacco is the single most important step for improving oral health outcomes. Limit alcohol consumption. Excessive alcohol reduces saliva production, creating conditions where harmful bacteria flourish and increase decay risk. Heavy drinking is a major risk factor for oral cancer, especially when combined with tobacco use. Alcohol can contribute to teeth grinding and poor oral hygiene habits. Drink in moderation and consume water alongside alcoholic beverages to maintain hydration. Visit your dentist regularly for checkups and cleanings. Professional examinations detect problems before they cause pain or become expensive to treat. Dental cleanings remove tartar buildup that brushing and flossing cannot eliminate from hard-to-reach areas. Regular visits allow tracking of oral health changes and early intervention for developing issues. Most people benefit from visits every 6 months for optimal preventive care. Don't wait for pain to schedule dental appointments. Dental problems often progress silently until reaching advanced stages that require extensive treatment. Early stage decay and gum disease rarely cause discomfort, but can be easily treated when caught early. Preventive care costs significantly less than restorative procedures like crowns or root canals. Regular checkups identify issues while they're still manageable and less expensive to address. Consider dental sealants for additional protection. Thin plastic coatings applied to back teeth create barriers against bacteria in deep grooves and pits. Sealants reduce decay risk by up to 80% and are especially beneficial for children and cavity-prone adults. The painless application process requires no drilling and can last several years with proper care. Sealants are most effective when applied to newly erupted permanent molars. Monitor your overall health as it relates to oral health. Diabetes increases gum disease risk, while gum disease makes blood sugar control more difficult. Many medications cause dry mouth, increasing cavity and gum disease risk through reduced saliva production. Conditions like heart disease and osteoporosis can affect oral health outcomes and treatment considerations. Work with healthcare providers to manage conditions that impact your mouth. Start oral care early for children. Begin cleaning babies' gums before teeth appear and brush first teeth with fluoride toothpaste immediately upon eruption. Establish twice daily brushing routines and supervise children until they develop proper technique around age 7 to 8. Schedule first dental visits by age 1 or within 6 months of first tooth appearance. Early habits and professional care prevent childhood decay and establish lifelong oral health foundations. Maintain consistent routines throughout life. Aging increases oral health challenges through medication side effects, physical limitations, and medical conditions. Adapt oral care techniques as needed while maintaining daily brushing and flossing habits. Caregivers should assist elderly individuals who cannot maintain independent oral hygiene. Regular dental care becomes increasingly important with age for maintaining nutrition and quality of life. Continue regular dental care during pregnancy. Pregnancy hormones increase gum disease risk, which has been linked to premature birth and low birth weight. Morning sickness can expose teeth to harmful stomach acids that erode enamel. Routine dental care and most treatments are safe during pregnancy, with second trimester being optimal for elective procedures. Maintain excellent oral hygiene and nutrition for both maternal and fetal health. Monitor for gum disease warning signs. Watch for bleeding gums during brushing or flossing, as healthy gums should never bleed during routine care. Other signs include red, swollen, or tender gums, persistent bad breath, and gums pulling away from teeth. Advanced symptoms include loose teeth, changes in bite alignment, and pus between gums and teeth. Early detection and treatment can reverse gingivitis and prevent progression to serious periodontitis. Be alert for oral cancer symptoms. Look for persistent sores that don't heal within 2 weeks, unexplained red or white patches in the mouth, and lumps or thickening in oral tissues. Other warning signs include difficulty swallowing, persistent sore throat, numbness in mouth or tongue, and voice changes. Early detection significantly improves treatment outcomes, making regular self-examinations and dental screenings crucial. See your dentist immediately for any concerning changes that persist. Use interdental brushes or water flossers as alternatives to traditional floss. Small cone-shaped brushes and water flossers effectively clean between teeth for people with dexterity issues or dental work. These tools can be easier to use than traditional floss while providing equivalent plaque removal benefits. Water flossers may be particularly effective for reducing gum inflammation and bleeding. Choose the method that you'll use consistently daily for optimal oral health outcomes. Wait 30 to 60 minutes before brushing after consuming acidic foods or drinks. Acids from citrus fruits, sodas, and other foods temporarily soften tooth enamel, making it vulnerable to brushing damage. Allow saliva time to neutralize acids and remineralize teeth before brushing to prevent enamel erosion. Rinse with water or chew sugar-free gum immediately after acid exposure to help neutralization. This timing protects teeth from cumulative damage that can lead to sensitivity and decay. Use sugar-free gum after meals. Chewing gum stimulates saliva production up to 10 times normal levels, helping neutralize acids and wash away food particles. Choose gum containing xylitol, which doesn't feed bacteria and may actually reduce their numbers in your mouth. Chew for 20 minutes after eating during the critical period when mouth acidity peaks. This is especially beneficial for people with dry mouth or when immediate brushing isn't possible. Consider professional fluoride treatments. Concentrated fluoride gels, foams, or varnishes provide enhanced cavity protection beyond regular toothpaste levels. These treatments are especially beneficial for high-risk individuals, including those with frequent cavities, dry mouth, or exposed tooth roots. The quick, painless application allows fluoride to be absorbed over several hours for long-lasting protection. Avoid eating or drinking for 30 minutes after treatment to maximize fluoride uptake. Wear a mouthguard during contact sports and high-risk activities. Properly fitted mouthguards significantly reduce risk of chipped, cracked, or knocked out teeth during sports and high-risk activities. Custom guards made by dentists provide superior fit, comfort, and protection compared to store-bought options. Replace guards when they become worn or no longer fit properly for continued effectiveness. Clean guards after each use and store in ventilated containers to prevent bacterial growth. Keep dentures, retainers, and other oral appliances clean. Daily cleaning prevents bacterial buildup that can cause bad breath, infections, and appliance deterioration. Use appropriate cleaning solutions and soft brushes, avoiding abrasive regular toothpaste that can scratch surfaces. Soak overnight in recommended solutions and rinse thoroughly before wearing. Regular dental checkups should include appliance examination to ensure proper fit and function. Drink plenty of water throughout the day. Adequate hydration supports saliva production, which neutralizes acids, fights bacteria, and helps repair early tooth damage. Water helps rinse away food particles and bacteria throughout the day, reducing plaque buildup. Fluoridated water provides additional cavity protection through constant low-level fluoride exposure. Aim for at least 8 glasses daily, with higher needs during physical activity or hot weather. To avoid using teeth as tools. Using teeth to open packages, crack nuts, or hold objects can cause chips, cracks, or breaks that require expensive repairs. Even if damage isn't immediately visible, inappropriate use creates microscopic cracks that weaken teeth over time. These activities can also damage existing dental work like fillings and crowns. Keep proper tools easily accessible and make conscious choices to use appropriate implements instead of teeth. Consider using a night guard if you grind your teeth. Custom-fitted night guards protect teeth from damage caused by nocturnal grinding and clenching, which many people do unconsciously. Signs include waking with jaw pain or headaches, worn teeth, and partner reports of grinding sounds. Untreated bruxism can cause serious tooth damage, jaw disorders, and chronic pain over time. Custom guards from dentists provide superior fit and durability compared to over-the-counter options for long-term protection.